Well, good afternoon, and thank you for joining us today. Yesterday, we issued a mandatory order to close non-essential workplaces by midnight tonight and encourage employees to work from home where possible and when possible. There are a lot of questions regarding what can and cannot remain open. And our officials are working with businesses across the province to give clarity. What may not seem essential to downtown Toronto or urban areas may be essential to rural Ontario, and the same goes for the other way around. I just got off the phone with the leaders in the construction industry. We're working with them to ensure the well-being of workers. Across the province, thousands of families are waiting to move into new homes that are days or weeks away from completion. When it comes to necessities of life, shelter is at the top of the list. And we cannot take lightly a decision that could put shelter for thousands of people at risk. Yesterday, I put the construction industry on notice. Our Chief Prevention Officer has sent out new guidelines for construction sites. And there are currently dozens of provincial labour inspectors at numerous large job sites to ensure appropriate protocols are in place. These inspectors will not hesitate to shut sites down. Let me be clear. If the industry does not take every step necessary to look after their workers, I will shut them down. Because this is the first and foremost a public health emergency. A public health comes above all else. Shutting down non-essential workplaces was a necessary decision, and we will not hesitate to shut down further workplaces as needed. We need to do everything possible to slow the spread of COVID-19. As a society, we're being asked to make tremendous individual sacrifices. To get through this, we must all make sacrifices. We must put our collective well-being above all else. And today, we're recognizing the sacrifice that people and businesses are making during these difficult days. We're taking a necessary step to provide some certainty for small businesses and some relief for families. We know this is a challenging time for all Ontarians who are doing the right thing by staying home. We realize this means people are using more electricity during the day. To help family and households across the province, we're switching to off-peak time of use electricity rates, saving customers over 50% compared to peak rates for the next 45 days. We also know many small business owners and farmers who are providing non-essential services are worried about paying the bills. I'm pleased to announce small businesses and farms will also be eligible for these reduced rates. This means you will pay the lowest rate possible 24 hours a day, 7 days a week. You won't have to do anything to receive the savings. The new rate will apply to the power you're using today, right at this moment, and for the next 6 weeks. There are no complicated applications or waiting periods. The savings will simply show up on your next bill. We're leaving more money in people's pockets, money that you can use to take care of your family or strengthen your business. We're also providing more flexibility for people to work from home, take online courses, do the laundry, or run the dishwasher instead of waiting for the evening to come around for off-peak hours. We're making things a little bit easier during some hard times and supporting everyone out there who is following the rules and doing their part to stay home. I also want to mention that our government is helping out our truck drivers who are keeping our supply chains running. We'll be keeping en route locations and other rest areas open so drivers can refuel, order takeout, and can get a break. And we're stepping up disinfection and cleaning at these facilities to keep everyone safe and healthy. And we're using Ontario's electronic highway signs to remind people to stay home and only travel when it's absolutely necessary. We're thankful for everyone who's doing their part to stay home and practice physical distancing, keep our province running, and help everyone stay safe and healthy. You're doing the responsible thing. Your actions are making a real difference. Simple actions like these will go a long way in stopping COVID-19 and flattening the curve. And now I'd like to invite Minister Rickford to share more details about the announcement and the work he and Minister Walker are doing to secure our hydro networks.
I want to thank you, Premier, for your leadership, and I'm pleased to be joined by my Cabinet colleagues, especially Minister Bill Walker, who's been a great help on this initiative. In fact, I want to thank all of my Cabinet colleagues, and in particular my caucus colleagues who've made important contributions to the relief we are providing Ontario families here today. This announcement represents an investment of over $160 million to hold time-of-use electricity rates to the off-peak price for 45 days. Starting today, right now, all customers who are currently billed under time-of-use pricing will be charged the off-peak rates of 10.1 cents per kilowatt-hour at all hours of the day. No action is required from electricity consumers. This change will happen automatically for everyone who is paying time-of-use rates. Minister Walker and I have worked closely with the Ontario Energy Board, the Independent Electricity System Operator, and local distribution companies across the province to make this happen, and I thank everyone for their tremendous efforts. Our government continues to listen and respond to your concerns during this difficult time. We are making this investment to provide needed relief to Ontario families and businesses who are doing the right thing by staying home. We know that small businesses, whether open or closed, continue to have electricity costs and need help during this difficult time. Finally, I want to take this opportunity to assure Ontarians that our energy sector is strong. Ontario is well equipped to provide us with a reliable supply of electricity in any situation. We have world-class electricity operators who are maintaining our strong grid supply and ensuring workers are taking appropriate health and safety precautions. Et maintenant, je vais vous présenter les détails en français. Nous avons écouté les peines des Ontariens et des Ontariennes et nous comprenons que rester à la maison entraîne une hausse de la consommation pendant le jour. Nous comprenons aussi que les PME, ouvertes ou fermées, doivent continuer à payer leurs facteurs d'électricité et ont besoin d'aide pendant cette période difficile. C'est pourquoi, dès aujourd'hui, à minuit heure de l'Est, les Ontariens et les Ontariennes vont payer le tarif applicable aux heures creuses en tout temps, soit 10,1 cents par kilowattheure. Cela s'applique à tous les ménages, les fermes et les PME qui paient actuellement en fonction de l'heure de consommation. Nous allons maintenir cette tarification pendant une période de 45 jours pour soutenir les Ontariens et les Ontariennes pendant la pandémie de COVID-19. Les consommateurs n'ont aucune mesure à prendre. La tarification réduite s'appliquera automatiquement sur les facteurs de ce qui paie actuellement en fonction de l'ère de consommation. We must all do our part during these uncertain times. Last week, we took immediate action to ensure that no family or individual will have their electricity disconnected during the COVID-19 outbreak by implementing a ban on any disconnections from electricity or natural gas supply across this great province. And today, we're proud to invest in additional electricity relief for the people of Ontario. Thank you. I'll turn it over to the Premier to take questions.
Okay, we'll move to the phone line. First question.
First question comes from Travis Dunrush of Global News. Please go ahead.
Afternoon, Premier.
Hi, Travis.
Question for you. One's kind of broad, the other one's more specific. And I know this is a difficult situation for everyone, but right now we have doctors from 5 hospitals on social media that are begging for personal protection equipment. Why is that happening in one of the richest economies in the world, considering what this province went through during SARS? Why weren't we properly prepared for this pandemic?
Well, I'll answer it, and then I can pass it over to the Minister of Health. We have all hands on deck, making sure that we can secure a safe and supply of health products that will make sure our frontline healthcare workers are safe. We are on the call day in, day out. Again, last night I was on with our procurement folks at 11 o'clock at night. Again, first thing this morning, everyone is out there going full steam ahead, making sure that we can acquire the masks, the ventilators, other items that protect the frontline healthcare workers. We're seeing light at the end of the tunnel. We're getting more masks. We have, as I mentioned the other day, there was 12 million gloves on order and coming in. So if they're short, we are going to make sure over the next day or so that we're going to fulfill the requirements. And Travis, I got to give a shout out to the private sector. A gentleman by the name of Jeff Kenyard, the CEO of Home Depot Canada, called me up out of the blue and said, Doug, I have 20,000 N95 masks, and Home Depot would like to donate it to their frontline healthcare workers. We thanked them. This is the generosity of the private sector, that people are stepping up, donating masks or any other items that the frontline healthcare workers are using. So it's a shout out to Home Depot. I thank you. I thank all other businesses stepping up to the plate. Those 20,000 masks will be distributed in the next day or so. As soon as we receive them, they're being shipped over today, he told me, and we're going to make sure those 20,000 masks out there. I'll pass it over to the Minister of Health right now.
Thank you, Premier. We do have an adequate supply of personal protective equipment for all hospitals, all frontline health workers. At the moment, we want to make sure that everyone who is either testing or working with people with COVID-19 are properly protected. We need our frontline workers to be protected, to protect their own health, the health of their families, and the health of the people that we're working with. That said, we have heard from several areas that they are running short on supplies, and we were providing them with supplies as soon as we hear of their needs. We are dealing, I think it's fair to say, with an international competition for personal protective equipment, but we are receiving our supplies in, and we are working with local Ontario companies. I share the Premier's respect, and we're very grateful for the work that's being done internally to work with automotive part manufacturers to help us to produce more ventilators, with other companies that are producing gowns and masks. The supplies are coming in. This is what I spend a good part of my day on, is working with Ontario companies and trying to move this forward as quickly as possible. But we currently do have the supplies that we need.
Okay, Premier, just more specific.
Travis, let me just elaborate on this until people can get the perspective. When we talk to their distributor for Canada, or we talk to 3M directly, these N95 masks are coming from Singapore. They're coming from the UK. They have one plant in South Dakota that all of America is drawing on. The UK plant under the European Union, they will not give North America the masks. So we're doing everything we can to make sure we have a supply on hand, put repetitive orders in for 1 million masks, a blanket order for 2 million, and we're making sure that our name's on the list. I was on the phone yesterday with 12 other premiers and the Prime Minister. Everyone's facing the same challenges. Talked to Premier Legault this morning. He's facing the challenges as well. But as the Minister of Health said right now, we have the supply, we're getting more, and we're doing everything we can. That is what we are focused on 100%.
And Premier, I have a specific question on a certain situation. I'm doing a story tonight on a group of 6 Ontarians that are stranded in Cusco, Peru. There are flights that are going to that country over the next few days, but right now there are none that are going to Cusco, and they can't get to Lima, which is 5 hours away. They are scared. They are running out of medications. Have you spoken to the Prime Minister about this, and what would you tell these guys that are going to be watching this story tonight directly?
Well, Global Affairs is working on that situation along with others. I'm going to tell you good news. Remember the group from Peru? With the cooperation of Global Affairs, the federal government, and Air Canada, they're back home. So that's fabulous news. I don't look at jurisdictions, even though it's a federal jurisdiction. If someone calls me, and many have had, no matter if it's in Ecuador, I've heard about folks being picked up. We're doing everything we can. And I want to thank Air Canada and other airlines right across the board that have offered to send planes down there. Porter Airlines on short distances have offered to move people from point A to point B when needed. And Sun Vacation, Sunjet, I believe, they've offered as well. So we want to thank everyone for their cooperation on that. But I will, if you want, Travis, I will personally follow up and get that answer for you with Global Affairs, and I'll have myself or someone get back to you directly.
Next question.
Thank you.
Next question comes from Christina Tenavia of CP24. Please go ahead.
Hi, Premier. Hi, Minister. Thank you for your time. I know you've just addressed the question of PPEs, but a doctor tells us he organized a community PPE drive at his hospital because the ministry wouldn't set up a centralized way for he and his colleagues to collect this personal protective equipment. And Minister, I know you said that there are adequate supplies and you're providing those to hospitals who have this need. So why are we hearing from hospitals that there is no way for them to access these adequate supplies, or at least no centralized way?
Yeah, I'll have the Minister of Health answer that.
Thank you. Well, first of all, we do have a centralized collection process. Ontario Together is a way that people can be in touch with us to offer equipment and supplies, personal protective equipment. But secondly, I know that this is being organized by a particular doctor at a particular hospital. We do have a central collection place. If hospitals or particular health providers are finding it difficult and they're running low on supplies, they can be in touch with us, with Ontario Health. We will make sure that we get the supplies to them. But we're also grateful for the collection efforts that they're providing at this individual hospital. We are all in this together. We all need to work together, and we will get the supplies that we need. But we are able to collectively work with individual hospitals and healthcare providers to get them the equipment that they need.
Thank you, Minister. My follow-up question is for the Premier. Premier, thank you for your comments off the top for the construction industry. We have been inundated with questions about this even after the announcement last night, particularly that it remains an essential service. My question is, if construction workers continue to show up to these sites and they don't feel safe, you said yesterday, don't show up to work, go home.
That's right. And
who will compensate them?
Well, let me be very clear to all construction workers. We passed legislation, not just construction workers, any worker in Ontario. If you don't feel safe in your workplace, your job will be protected. You can leave the job site. I had a discussion with labor leaders. I've had a discussion with some of the largest contractors in the entire country saying, get your act together. I have zero tolerance for sites that have overflowing outhouses, don't have hand sanitizer, have running water. And a couple comments from them is, you know, one person told me that the construction folks are taking the hand sanitizer out of the outhouses, and another person made a good point. Well, you know something, with all the water we have in this country, there's no excuse for these general contractors to have water and soap there. We will not hesitate. We have inspectors all over these sites right now as we speak, and we're going to continue day after day inspecting these sites, and they have the authority to shut down any site in the province. And we want collaboration. We want cooperation. Vast majority of these general contractors, vast majority of these labor leaders are cooperating. They're doing a great job. There's some bad actors out there that are causing a problem for the whole sector. And again, if you go on site and you don't feel it's safe, then you can walk off. You can contact your union leader, your rep, but they need to make sure they follow the guidelines. We will not hesitate to shut these sites down, as our list shows, and there's an endless list. And I understand there's lists, and I'm probably going to get a few more questions about that list. In saying that, we've had tremendous cooperation from the people right across this province. All you have to do is, I'm talking for Toronto, you just drive down here and it's like a ghost town. So people are cooperating, people are listening, and we appreciate it. But they also, businesses, they have to use their judgment and their common sense. We can't, you know, go around and inspect tens of thousands of businesses if someone's working at a location. And again, I repeat, you don't feel safe, you walk off the site. You can call the Ministry of Labour as well.
Next question.
Thank you, Minister. Thank you, Premier.
Thank you.
Next question comes from Laura Stone of the Globe and Mail. Please go ahead.
Hi, Premier.
Hi, Laura.
We're seeing some restrictions on interprovincial travel in Nova Scotia. I'm wondering if Ontario is considering closing provincial borders to non-essential travel or requiring self-isolation for people who are crossing into Ontario.
Well, again, great question, Laura. I had that conversation with Premier Legault. It's a vast border. And again, we're hoping and praying that people are listening. And if they don't have to travel, do not travel. It's absolutely critical. We can't stress it enough. And then people coming from abroad, landing here, it's concerning that people, I've heard stories even this morning. They land, they go to the hotel last night, and bang, they're back on another flight. And then that's understandable if they're traveling from point A to point B, and the only landing spot is in Toronto. But in saying that, please, when possible, stay at home. I saw a video the other day, and I might have mentioned it yesterday. I couldn't believe my eyes. People in Mississauga, and I'm not pointing out Mississauga, it just came from Mississauga. I'm sure it's happening some other places. You go to the playground, and there's half a dozen kids all going on slides, you know, playing with each other, touching it with the parents around. I'm thinking, you got to be kidding me. Folks, please, stay at home. I understand you have to get out and walk around the block to get some fresh air. I get it. Go with one other person, but please don't bring your kids to the playground with a whole bunch of other kids, and they're all going down the slides and everything else. You can't do it. I can't stress it enough. But a very good point, Laura.
So just to clarify, you said you spoke to Premier Legault about this, but it sounds like you're not taking any formal measures?
Well, it'd be very hard, Laura, to police it. You know, we're asking right now, please do not travel. Bottom line, no matter if you're going west, if you're going east, please do not travel. I can't be any more clear than that. The border is absolutely massive. on both sides of the border, on the west, east, and the south side as well. So please stay at home. And
just on, sorry to interrupt.
yeah, that's all right. Go ahead.
I just want, just on another topic regarding the fiscal update for tomorrow.
Yes.
Is that now solely focused on COVID-19 and in particular additional resources for the healthcare system? And are you considering, or are you going to send money directly to Ontarians who are out of work, or top up what the federal government has already announced for businesses and people who are now unemployed?
Well, I had that conversation. I'm going to pass it over to the finance minister, but before I do, we had that conversation with all the premiers on the phone, along with the prime minister. The fiscal capacity of the province is not the same fiscal capacity of the federal government, plus the distribution of funds, and we don't want to duplicate. I was pushing hard to make sure we increase the funds that would be going to individuals. That was one of my questions, along with the other premiers, to the Prime Minister. Prime Minister is doing a great job working around the clock, along with the Deputy Prime Minister. I want to thank them. They're doing everything they can, and that was a question we posed. We're going to be following up, but I'm going to pass this over to the Minister of Finance.
Thanks for the question, Laura. The province of Ontario, first and foremost, is responsible for healthcare. So there will obviously be a significant focus on the response to COVID-19 and the healthcare components of that. But this will be the first steps in our plan to respond overall. So there'll also be support for businesses. But as the Premier has said, we are concerned about making sure that we're delivering the healthcare resources. We're concerned, and you saw today with the announcement with regards to time of use, that's money into people's pockets. And we are concerned about making sure we are supporting the business community as we can. But as the Premier has said, the federal government, and I think we complimented them last week, has stepped up with the direct support for individuals, with the income transfers that they've talked about, the expansion of the EI program. So our program tomorrow will represent that first step that allows us to make sure that, first and foremost, the healthcare system has the resources it needs, that we are have supports for people in the economy, but they're complementary to the significant effort the federal government's been making, and I think all governments, local, provincial, and federal, will continue to look at the situation as it evolves and make sure the supports that are required are there.
Next question.
Next question comes from Sean Jeffworth of the Canadian Press. Please go ahead.
Good afternoon.
Good afternoon, Sean.
Good afternoon, Premier Ford.
Okay.
Just wanted to ask you about your announcement today on time of use, specifically about the timeline that it will be in place. I understand it's 45 days. I'm wondering if that is an indication that the province thinks that people will have to stay at home for that length of time, and that this COVID-19 response is going to take that long to potentially resolve itself.
Well, thanks for the question. Before I hand it over to the Minister of Energy, we're just trying to take a little bit of the burden off the backs of people that have to stay home, that may want to do their washing or using more electricity. And when people are at home, they will be using more electricity opposed to when they're at work. So we just want to take a little burden off their backs, have the flexibility. I've said even during the election, Sean, I'm not in favor of this. We're spending well over $5 billion subsidizing people's electricity bills here in Ontario. We inherited the mess, and I'm not going to get deep into the weeds on politics. We inherited a real mess, and this is costing us another $160 million. But I think it's critical. It's absolutely critical. When people are at home, they have that flexibility more than anything. Yes, it's going to save some money. It drops, I think it's from 20 cents down to 12 or 10 cents per kilowatt, chopping it in half. It's just a small part. The government can help the people of Ontario, and I'll pass it over to Minister Rickford.
So this is calibrated over what we consider a reasonable amount of time to think about where we are now and prospectively where families will be in the coming weeks. We know that the state of emergency that we're in and the prospect that it may continue for a couple of weeks puts us out at a time period at least till the end of April. There's no playbook here, but we knew that at 30 days it wasn't going to represent enough of a savings for the millions of families who have shifted to their home base in a very real way, day in and day out, as the Premier and we as a government have asked them to do. And we feel very comfortable with the idea that by mid-May, if not shortly before, we'll be able to assess appropriately whether any further interventions would be required in terms of a time extension.
Follow-up?
Premier Ford, by way of follow-up, I just wanted to touch on your remarks off the top about the essential business list that was created. You alluded to the fact there are really different needs in urban and rural Ontario, and I'm wondering if you can walk us through the process that you and Cabinet used to come up with this list. Obviously, some people are looking at elements of the list and thinking, why was something included when something else was not included? You know, why are stores that sell beer and wine open, cannabis open, you know, when, say, other things are not? Can you walk us through that, please?
So first of all, I want to be very clear on this. That list can be adjusted. It can either be items can be taken off or added, similar to what Quebec is doing. It's going to be an open list, and I'll tell you what we did. We ended up talking to associations, be it the Retail Association or other associations throughout the province. We talked to labour leaders across the province. We've asked the Ontario Public Service to put a list together. We vetted it. There must have been, if you added up everyone, probably a couple hundred people that vetted this list. Our cabinet vetted it for over 2-3 hours one night, and then over the morning, the following morning as well. And I always say, Sean, you know, even myself, I can look at a list and with all the items, is this essential? And that's basically what we did, line item by line item. I think there's 69 or 68 line items. And I just want to touch on one of those items, the LCBO and cannabis. We met and heard. I didn't personally talk to them, but we heard from mental health and addiction that it's absolutely critical to keep that open. And they don't want to put more of a burden on the healthcare system. And I know some people at home are sitting back and thinking, you know, how does that work? Well, there are people out there with addictions. We're there to help them. We're there to support them. We're putting $3.8 billion towards helping people with mental health and addiction issues. But the advice we receive from them is make sure they stay open. And I'm going to give you another example when it comes to LCBO. I have a great deal of respect for Smokey Thomas, and this is what I'm talking about, true labour leaders that want to stand up and make a decision. Through our Minister of Finance, the discussion happened about closing LCBOs on Monday to do a full cleaning, which I agree with. But with the advice from a labour leader like Smokey Thomas, instantly, we made that decision to close it down, and that's the advice we're taking from experts and their area of expertise. So again, this list can be adjusted either way. It's an open list, and we'll make the following adjustments when needed.
Next question.
Next question comes from Colin DeMello of CTV. Please go ahead.
Hi there, Premier. Sean Jeffords actually asked my question, but I was also wondering, in terms of the hydro relief, do you expect landlords to pass on the savings to their tenants?
Well, I'll pass over to the Minister of Finance, but you know, if they're paying a separate hydro, some are all inclusive, some are separate. You get your own hydro bill. But in my opinion, if you have a savings, why wouldn't you pass it on to your tenants? I think it's the fair thing to do, but maybe Minister Rifford can answer that.
Well, thank you. There's been leadership from across the energy sector to take this extraordinary measure, and it's our expectation that compliance with passing savings on to people renting would be automatic. We have similar expectations of any of our partners that work in the energy sector to ensure that the people, families, and small businesses derive a benefit from this. Some people rent facilities from businesses, and to the extent that there's an accommodation in that bill for the use of utilities, that savings would be passed on directly, and we'll assess that situation on an ongoing basis.
Thank you for answering. I will pass it on to my colleagues.
Thank you.
Next question.
Next question comes from Lucas Meyer of News Talk 1010. Please go ahead.
Good afternoon, everyone. Thank you for taking our questions as well. Premier, on the essential business, I'm just curious because we've seen some kind of on-the-ground examples of businesses adapting, as you mentioned yesterday, to the change here.
Yes.
For example, some businesses are closing their doors, but they're moving to more of a delivery-based model.
That's right.
In that case, if businesses are doing that, say it's a clothing store or a flower shop, something like that that would be considered non-essential, but it's then moving to delivery only, will they be allowed to continue to operate?
Well, again, our number one priority, is the health and safety of the workers in Ontario. Number one over anything. We've said if you're going through drive-through, if you can deliver, that's a different scenario. What we're trying to avoid are people in stores. The reason we close down malls, to the exception of separate entrances to food stores or pharmacies or doctor offices, the retail stores are shut. If someone wants to deliver something, I understand that, and we wouldn't have a problem with that. But a number one issue, bar none, is health and safety of the people of Ontario. And again, any business, I just can't be clear enough here. If you aren't obeying by the orders from the Chief Medical Officer of Health, taking the advice from the government, and you want to break the rules, you're going to pay the penalty. Very simple. And but the vast majority of people, Lucas, it's like they're cooperating. Down at 1010, look out your door. This place is like a ghost town, so thank you, everyone. I thank you, I thank you, I thank you. I thank businesses, and I thank the people of Ontario, the 14.5 million people we have here, for cooperating. Yes, you're going to have the odd person, but again, the vast majority of people are cooperating.
And on healthcare, specifically about testing, we heard from the Associate Medical Officer of Health about how we may not really be getting the best case of cases because of the limits right now in tests. And I know that our colleague, Mr. Crawley, had a story in which he spoke to a specialist who said that the government should look at opening up colleges and universities for their testing abilities. So maybe this is a question for the Health Minister, Christine Elliott. Is that on the ministry's radar to find ways to open up more testing facilities, more laboratories to accommodate that with such a backlog?
Yes, absolutely. We do have a plan in place to increase our testing. We are up to about 3,000 tests per day at the moment. We hope to have it up to 5,000 tests per day by the end of this week, and then increase again after that to get up to 15,000 tests per day. We know that we need to increase the volumes, the locations for test facilities, and we are expanding them, making those contacts each and every day so that we can get to the required levels of testing that we have to be at.
So just to be clear, so colleges and universities specifically?
We're looking at a whole variety of places, public labs, private labs. We are looking at everything. We're not going to leave anything unanswered or unquestioned. We're making the contacts with all labs across the province.
Okay, next question. This will be the last question.
The last question comes from Robert Renzi of the Toronto Star. Please go ahead.
Hi, Premier. I'm just wondering, tomorrow's fiscal update, is that the last kind of straw in financial measures that the provincial government will have, or is it possible that we could have another statement, say, in 6 weeks or something like that?
Well, that's going to be phase one. And again, as we move forward, I'll pass this over to the Minister of Finance. But again, that is phase one.
So Rob, as the Premier said, this will be the first step in an important signal. Just to take this opportunity, recall that 3 weeks ago we were planning to present a budget very different because the economy was very different. But in consultation with the Premier and my colleagues, we made the decision that we needed to update our information. We needed to provide the most accurate information we could, and that's what we'll do in our economic statement tomorrow. We think that's important for a number of reasons. We have to make sure that our partners, municipalities, hospitals, school boards know the money that's going to be transferred every year. We also have to make sure that Ontarians know what we're doing. So we'll have our statement tomorrow. We've also committed to having a full budget by the time we get to November, middle of November. What we won't be doing tomorrow is providing any multi-year projections, and of course that's because it would be impossible to do so at this time. But we'll do that when hopefully the dust is cleared and we have a better sense of things. So tomorrow's statement's important because it's going to clarify for our transfer partners, the monies that they'll be getting, and it's also going to make clear to Ontarians we've got the money to support our healthcare system, we're going to be supporting jobs and people as well, and that their government has a plan.
Thank you. And back to the Premier. Premier, you said yesterday that it's not realistic for schools to reopen on April 6th.
Yeah.
The Premier of Quebec has said schools are going to stay closed until May. Do you think that that's more of the timeline that we'll be looking at, or could it be even beyond May and into June?
Well, we had that, Francois and I should say Premier Legault and I had that discussion as well. I had a good conversation with the Minister of Education, Minister Lecce, and we need to see where this is going. It's number one. Our number one priority, Robert, is to make sure our kids are safe, and we will do whatever it takes to protect our kids of this province. But let's see how this moves forward. But to answer your question, April 6th, kids won't be going back to school, and I know the minister is going to be communicating this over the next couple days. But thank you for the question, Robert. And again, something, the media's been great. I don't want to say this every single press conference, but the media's been incredible, and I want to thank them. I got to call someone out, Jamie here, that's in here day in and day out, doing the feed to all the other networks. Jamie, you're an absolute champion. So we thank you. The province thanks you, and the people of this great province thanks you well.
Okay,
thank you.
Thank you.